Hello dear aspirant students, welcome on the Pharmacology multiple choice question session discussion. So as you know, we are doing large number of multiple choice questions on these modules, almost 200 questions, and every session is having 10 questions, and it helps you for the journey of pharmacology to go from this chapter to that chapter and try to memorize. So we are on a fresh session, and let's begin with question number 1. All of the following undergo hepatic metabolism before excretion except phenytoin diazepam, penicillin G, cimetidine and paracetamol. All of the following undergo hepatic metabolism before excretion except. It means all these drugs are metabolized in the liver. Which drug has no connection with the liver metabolism? And let's go through the options once again. Phenytoin, diazepam, penicillin G, cimetidine and paracetamol. Is there anything different? Very different. If you remember, we are speaking about one antimicrobial agent here. Rest of them are not antimicrobials, and that's penicillin G. What is penicillin G? Penicillin G is benzyl penicillin. That's the first penicillin. That's the natural penicillin. And if you remember, it had to be given by parenteral route of administration, by intravenous route of administration. That's one. Why intravenous route of administration? Because if it was given by oral route of administration, it used to get destroyed by the gastric hydrochloric acid. So we call it acid labile. So no thinking, no question of going up to liver. The major amount is destroyed by gastric hydrochloric acid. That's why we don't have penicillin G itself in the form of tablets or capsules. So the answer should be penicillin G. We go to the answer. Yes, that's the right answer, penicillin G. Next question, question number 2. In a patient taking oral contraceptive, the chance of pregnancy increases after taking which of the following? Are you thinking? The question is saying patient is taking oral contraceptive and the chance of pregnancy increases after taking which of the drug, which means there has to be a drug interaction between one of the following drugs with oral contraceptive so that there is pregnancy. If there is pregnancy, it means the oral contraceptive is ineffective. So what could be the substance which will make the oral contraceptive ineffective? If it has to make it ineffective, it should destroy it. It should increase its metabolism. I hope you are appreciating the way we are thinking. So its metabolism has to be increased. And if you remember your general pharmacology, then increase in the metabolism, stimulation of the metabolism by certain drugs is called as induction of metabolism. So if any of the following drugs inducing and increasing the metabolism breakdown of oral contraceptive, it won't be able to achieve the required contraceptive concentration. So in other words, from the following drugs, we have to choose an inducer. So there is rifampin, isoniazid, pyrazinamide, ethambutol and streptomycin. Once again, rifampin, isoniazid, pyrazinamide, ethambutol and streptomycin. All these agents are anti-tuberculosis agents, and we need to know which one of the following is an inducer of microsomal enzyme. I hope you are able to think. There's only one inducer in this list, obviously, and it's called rifampin or rifampicin. That's the inducer. There's one more agent here, isoniazid, but it's not an inducer. It is an inhibitor of the cytochrome P450 enzyme system. So the answer has to be, I show you the answer, that's rifampin. Let's go to the next question. Which of the following is not used in erectile dysfunction? Vartalafil, phenylephrine, alprostadil, prostaglandin E2 and sildenafil. I think this question will work well. Vartalafil and sildenafil, both are from the same group, phosphodiesterase inhibitors, and they are going to produce vasodilation, so they will be useful in erectile dysfunction. Alprostadil is again prostaglandin analog, and you have BGE2 itself in the options. So these two are gone. So you are left with phenylephrine, and it becomes an easy choice between these 5. Which of the following is not used in erectile dysfunction? It will be phenylephrine. Phenylephrine is an alpha stimulant, and it won't have anything to do with erectile dysfunction. Next, we go to question number 4. Look at the answer for question number 3. That's phenylephrine. Question number 4. A 65-year-old man suddenly stops consuming opium after continuous use for 20 years, which is likely to occur due to the withdrawal. So what they are questioning to us is the symptom of opiate withdrawal, which is likely. Number 1, A, rhinorrhea, B, hypotension, C, drowsiness, D, meiosis, and E, constipation. Please remember, when you stop a drug, such a drug like opium, you get the manifestations which are opposite to its normal actions. I hope you remember, opium is a vasodilator. It produces hypotension. Opium produces drowsiness. Opium produces pinpoint pupils. Opium produces constipation. So all these four are the actions of opium. They are less likely, and that's why the option is likely to be rhinorrhea. So that's the answer for question number 4. We go to the next question. And the next question is question number 5. Which of the following causes hepatic granuloma? Amiodarone, alcohol, cimetidine, metronidazole, and ampicillin. There are 2 types of toxicities which can happen when it comes in terms of the metabolism breakdown. Number 1 could be the drug goes to that particular system and accumulates, and it can do certain effects. The second type of effects can happen, which could be carcinogenic effect, forming a tumor, etc. It's a hepatic granuloma, and if the granuloma has to form, the drug has to go to that particular organ in a large dose. It has to accumulate there, and the distribution of the drug in this particular tissue has to be wide. I gave you a hint. You have amiodarone, alcohol, cimetidine, metronidazole, ampicillin. I know this alcohol is tempting you, but please think, alcohol doesn't produce hepatic granuloma. It could be something else. It could be a hepatoma, or it could be a cancer, or it could be liver cirrhosis, it could be fibrosis. We're speaking about granuloma. So is there any drug amongst the rest of the drugs which goes to the liver and which accumulates the liver and there's distribution in the liver? If you remember your antiarrhythmic drugs, we had a drug called amiodarone, which has very wide distribution, which has a very long half-life, goes to various tissues, goes to thyroid, goes to liver, gets deposited in the cornea. So this drug produces toxicities at various places. One of those places is liver, and that leads to hepatic granuloma. So the answer is amiodarone produces hepatic granuloma. The next question is question number 6. Coronary steal phenomenon commonly is seen with which of the following? You have atenolol, diltiazem, nitroglycerin, dipyridamole, and there is aspirin. There is one drug on this list which has got a very typical effect. It produces dilation in the smaller blood vessels, and due to this, the result sometimes is the blood in the ischemic region is taken out and gets redistributed to the normal areas, to the other areas, and we go to the answer. The name of the drug is dipyridamole. The effect of dipyridamole is blood gets diverted away from ischemic area, and this could be sometimes the cause of failure of dipyridamole. So coronary steal phenomenon, dipyridamole. We go to next question, and that's question number 7. A patient taking ketoconazole for fungal infection develops cold, for which he is prescribed terfenadine. Possible interaction is. Let's read the question once again. Ketoconazole for fungal infection and terfenadine for cold. What's terfenadine? Terfenadine is a generation 2 antihistamine. So ketoconazole and terfenadine. Ketoconazole, do you remember anything about ketoconazole before going to options? Yes, it's used for fungal infections and anything else. It's an azole antifungal. Does ketoconazole have any other effect? Does it affect the metabolism of other drugs? Because we are being asked about a drug interaction, first think about metabolism. Do you remember? Ketoconazole is from azole antifungal group, and it inhibits the cytochrome P450 enzyme system. And because of the inhibition of this system, it could decrease the metabolism of number of drugs, and that other drug is then going to accumulate. So this is the possibility which is maximum in case of this drug interaction, that's ketoconazole and terfenadine. So if ketoconazole inhibits the breakdown of terfenadine, terfenadine will accumulate and its toxic effects are likely to happen. Now let's read the options. Decreased metabolism of terphenadine. Yes. Oh, it's option number A. That's good. So this seems to be B. Terphenadine increases levels of ketoconazole. No, not possible. C. Ketoconazole decreases the level of terphenadine. No, the level will be decreased if the drug is metabolized fast. This drug, ketoconazole, is inhibiting the metabolism. Next, no drug interaction. And last is E, additive effect. I think D and E both are not relevant options. So we are simply left with the option number A, that is decreased metabolism of terphenadine. That's correct. Ketoconazole inhibits the metabolism of terphenadine, and terphenadine can precipitate severe dangerous cardiac arrhythmia, Torsett D point arrhythmia. Please remember this. So terphenadine has been withdrawn from market in many countries. So that's the drug interaction. Any cytochrome P450 enzyme system inhibitor is going to inhibit the breakdown of terphenadine, and that will lead to cardiotoxicity. Decreased metabolism of terphenadine is the answer. We just confirmed, endorsed the answer, and now we move on to the next question. That's question number 8. Single oral dose therapy given in HIV patients during labor for preventing the transmission to the fetus. We have to give it during the labor to the mother, and it should prevent the transmission to the fetus. The question is, which drug is given as single oral dose therapy to this woman? Look at the options: zidovudine, nevirapine, lamivudine, indinavir, and ritonavir. If you know the first two drugs, zidovudine and nevirapine, they are used for this particular prophylaxis. But zidovudine has to be given more continuously, has to be given for longer periods of time. And nevirapine, a non-nucleoside reverse transcriptase inhibitor, that's NNRTI, is able to prevent the transmission to the fetus when it's given in a single oral dose. So the answer to question number 8 is nevirapine. Please remember the two drugs, zidovudine and nevirapine, for prophylaxis in pregnancy, and the answer for the question single oral dose therapy is always going to be nevirapine. Zidovudine has to be given for fairly long period of time. Let's go to next question number 9. C-peptide is part of insulin, proinsulin, growth hormone, ACTH, and thyroid hormone. And I think that's going to be easy. It's your biochemistry. C-peptide is part of, you can see the answer, that's proinsulin. We go to last question on this session, question number 10. Chloramphenicol is useful in options: A, bacterial conjunctivitis, bacterial meningitis, TB, that's tuberculosis, typhoid fever, and streptococcal sore throat. Chloramphenicol, it's a broad spectrum antimicrobial agent, and chloramphenicol is almost an out of date drug. It's not very commonly used. It produces bone marrow suppression and Gray-Weber syndrome, as you already know, are the common adverse effects. It's bacteriostatic, relapses are possible, cure is not complete, and the final reason is better drugs are available. That's the reason why chloramphenicol is not commonly used. So if at all we want to use chloramphenicol, we would think of using it for very serious infections when the infections are not going to respond to the routine line of drugs, or we could think of using it for local uses. Now options are bacterial conjunctivitis, bacterial meningitis, tuberculosis, typhoid, and streptococcal sore throat. One thing is simple, it's not an anti-tuberculous drug, and as far as typhoid fever is concerned, the organisms are resistant to chloramphenicol. So tuberculosis and typhoid fever is gone. Next you have streptococcal sore throat, and you have so many other options available which are better and less toxic. And next one is again bacterial meningitis. You have so many options. So we go for option number A, and that's called bacterial conjunctivitis. Yes, chloramphenicol is available for this particular use. It's available as chloramphenicol applicap, and it contains the ointment. You have to cut the applicap, squeeze the applicap, and put the medicine, put the ointment in your eyes. That's bacterial conjunctivitis. So chloramphenicol is useful in bacterial conjunctivitis. I showed you the answer and we confirmed. I think it was fairly rapid, and you could revise some chapters in pharmacology. It's going to be helpful to you, and my good wishes. Thank you so much.